Well, hello there, Dr. Brian McCain, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Today, we're going to be discussing neuropathy Q&As. We get a lot of these questions, and today we're going to answer them. So it's only fair we get these things out there and help away and answer what we can. So here's the neuropathy. Okay, so what happened is we started seeing a lot of patients. Now, as a chiropractor, really don't treat neuropathy. But since I'm a chiropractor, people think everything we do here is chiropractic. It's not true. But what I was doing was I was finding that people respond to a number of different treatments, therapies that are kind of out of the box. Because if you get diagnosed with neuropathy, it usually comes about because you have chemotherapy, alcoholism. It could be trauma, but very very rarely is it traumatic in pathway that you're going to get neuropathy from. Neuropathy is usually a more long-term thing, and the other one is diabetes, where too much sugar really does a number on the blood vessels, and there's a lot. I'm not going to go into the etiology of it today, but I'm going to answer some of the questions. So here's the first one: is peripheral neuropathy curable? The answer is no. The symptoms associated with peripheral neuropathy are treatable. Okay, there's a very, very big difference. And also, too, the same, here's the questions that I got was can peripheral neuropathy be reversed? The symptoms of peripheral neuropathy can be reversed. That's the one thing is because neuropathy is kind of a comorbidity of an underlying condition. So, like I said, I'm not going to treat cancer. I can't fix an alcoholic's problem, and I can't fix a diabetic's problem. So those have to be monitored. So this is why, neuropathy is not curable, is not reversed, and cured. It just doesn't. You can't cure it. What you have to do is minimize the symptoms, because the symptoms are a symptom of another thing. That's why we call it a comorbidity. So putting that to rest, you cannot cure and you cannot reverse neuropathy. You can make the symptoms subside and go away, which is all you can do, and it can be done very well and add to the quality of life. Because someone, here's some of the symptoms of peripheral neuropathy. That's another question we get. So if someone comes in with neuropathy, you have, first of all, the symptom I'm more concerned with is, and it's probably not addressed that often, is balance. I mean, a person's balance goes to, for lack of a better descriptor, balance goes to hell. And people are not concerned with, because balance is not a painful episode, okay? Whereas numbness, and numbness is not a painful thing either. Lack of sensation, that's to me is, again, more important. Balance, numbness. Tingling is something you could live with. Pain, okay. A lot of times people start having pain in the extremities, and it's usually going to be the feet more so, feet and legs more so than the hands. And the reason why is because the feet and legs are further away from the heart, so you have a problem with getting blood flow. And again, typically neuropathy is, the symptoms are, the signs that I look for is lack of oxygenated blood, lack of blood flow, lack of proper nerve stimulation, and lack of glucose regulation, and lack of stimulation. Maybe I'm repeating that one. So those are how I see neuropathy, and know if those symptoms exist, that we can make a positive difference. Like if you're not getting enough blood flow, we use laser therapy to dilate the blood vessels by stimulating the body to produce more nitric acid. Nitric oxide, not nitric acid. Nitric oxide, which is a vasodilator, very powerful vasodilator. And like many things in our bodies, we produce less and less of as we get older. So vasodilation opens up the blood vessel, you can get more blood flow. Now, that blood flow has got to be properly oxygenated. Now, if you're not getting enough oxygen, one of the things we really got to do is you got to get, we use a thing called blood flow restriction, where it's a therapy, an exercise where we actually wrap these restrictive bands around the extremities and take a person through some exercises, and it deprives the muscle of blood flow and oxygen as well, because the oxygen travels through the blood flow. And what it it does is you open it up, there's the pent up demand, and it puts more of a demand on the body to get the oxygen to the area. So it kind of super oxygenates the tissues in the legs, the feet, like again, primarily like we're doing mostly lower extremity. Um, Another thing we do if someone's in better shape physically or younger, we're going to use negative oxygen. We'll put you on a bicycle um, or a vibratory plate, and we make you go through these exercises with like a lower oxygen concentration. Typically, your O2 levels should be 99, 98, 99, or 100. And so the deficit places it's on the heart and the lungs. So you have to work more efficiently. So you have to work harder to do the same exercise. And as a result, you're going to force more oxygen into the tissue. So it's kind of like just think of that, taking that deep, deep breath and how much better it feels once you do that. So when we're looking for these symptoms of neuropathy, you know, night pain, uh, that's probably like the biggest ones. Like people wake up in the middle of the night with leg pain, or they feel like bugs are crawling, or like you're walking on glass. It's just a serious change in sensation that becomes chronic over a period of time, and it needs to get addressed. And those are the ones that usually have people's attention. But a lot of times people don't want to make the changes in the dietary changes to make sure we get proper glucose stimulation. So, you know, it's really up to the person to work with us because our program is mostly home based. And the fact it's home based, there's several therapies we do every single day at home, and that's to one to get the nitric acid, nitric oxide. It's a Friday morning. Sorry if I keep calling it nitric acid. Do not take nitric acid, by the way. Nitric oxide, yes. Um, so that and then stimulation. Those are two things that we do at home, but we have to make sure that the person's following the right dietary recommendations. So there is better glucose metabolism. Okay, if you're diabetic and alcoholic, there's a reason why there's too much sugar, and sometimes the sugar high in concentrations will eat away the myelin sheath, which is again not a sympathy, not a symptom you're going to be aware of, but it's one of the problems that makes peripheral neuropathy even worse. So next question is peripheral neuropathy come and go? It starts that way and then it becomes more and more chronic. The longer you have it, what I think tends to happen is that people start to become much more sedentary. You know what I'm saying? It becomes more sedentary, so you don't get up as often because it hurts, or you again that loss of balance, which you really don't feel the loss of balance until you fall and realize how severe it really can be. So that is so the symptoms really don't go away. They come and go in the beginning, and then eventually they just start getting worse and worse and worse. But a lot of times the answer is just go to your doctor. He's going to put you on Lyrica, Cybulta, gabapentin, and that's it. That's the only thing they have. And those are very powerful medications. And they tend to have how many medications can you possibly take is really what comes down to. There's way too many medications that people take now on a regular basis. Well, as far as neuropathy, now we're going to take another one. I mean, your liver has to process all these medications. So one's taking you to the left, one's taking you to the right, one's taking you north, one's taking you south. So it really has. It's not a good thing to be on too many medications. And the way we do it, we don't use medications because first of all, as a chiropractor, I don't prescribe medication. But the idea here is, what can we do naturally to make the body function better in light of the underlying illnesses, be it diabetes, alcoholism, or a cancer that requires treatment. So that's really the purpose here is to help. And some people can go with that. And one question I got was peripheral neuropathy fatal? It's only fatal if your balance is off and you fall down and hurt yourself and die. So that's the way I would say it. It's just it robs you of the quality of life you really, really, really deserve. Okay, because again, you're going to become sedentary. If it hurts to walk, or it feels like you're walking on glass, or you're not sleeping at night, you're not getting rest, you're a little cranky. It doesn't. It's not neuropathy will not kill you again unless you fall down and get seriously hurt due to balance issues. But You know, it's tough. I mean, I'm going to give you a really wild example. I mean, somebody I knew who had neuropathy fell asleep with the feet near a fireplace. The feet were burning, and he couldn't feel his feet, and his body went into shock, and he ultimately died. So it's kind of a. I know that sounds really graphic, but that's a true story of somebody I know personally. And so in that case, yeah, I guess it can be fatal. But again, it's not usually on and of itself. So a mitigating circumstance that will cause neuropathy to be fatal, but for the most part, no. And so another question is, what is peripheral neuropathy and diabetes? I'll touch on it briefly, but that's a whole nother subject for another day. So what peripheral neuropathy and diabetes is, typically called diabetic foot pain. The feet hurt a lot. Again, why? Because the feet are further away from the heart. The blood flow is not what it could be. Also, too, is think about your arteries, your capillaries, your veins kind of being dried out. It's supposed to be nice and soft, and pumping full of blood to, and pumping away, blood, from on the way back to the heart. So you really have this tax on the system. It's kind of like a car, an older car that just doesn't run well. Well, in diabetes, very few things are running well because you have this sugar imbalance, and the glucose in your body is out of whack. It's insulin resistance, and so you really lose control. And it's very hard. People don't really follow the diets as well as they're supposed to. I mean, they'll take the medication, but they don't follow the diets as well, and that's one of the problems with peripheral neuropathy and diabetes. I mean, as a matter of fact, most of the people we see with peripheral neuropathy are diabetics. That's the one thing I can definitely point out. And as long as they're willing to make the changes in their diet, you usually can get a good response, and really seriously minimizing the symptoms. That foot pain, the imbalance, everything else just goes with the with neuropathy. Another question here is, how long does peripheral neuropathy last? Well, as long as you're alive, if you don't treat it properly. So peripheral neuropathy can it just becomes part of your life. I mean, maybe a cancer patient who has time for the toxins to clear out of their bodies, they'll see more resolution. If an alcoholic stops drinking, if a diabetic's no longer diabetic. So I guess that's to answer it. But I'm not trying to be a wise guy about it. But it can last a long time, and it really comes down to how much sacrifice the person who has peripheral neuropathy is willing to make to get it under control. So it's a matter of controlling anything. It's like, listen, you're overweight. How do you control it? How you stop dieting? Um, well, stop dieting. Guess what? The weight's going to go back on. So I think it's more of a common sense answer. Here's another one: can peripheral neuropathy kill you? Like I said earlier, if you fall down and get hurt, I mean, when your balance is off, you can't feel your feet, and you start tripping over stuff. That's a serious problem, and it really is something that can, be mitigated with the program that we have here at Neuropathy CoreHealth. Next question is, peripheral neuropathy hereditary? Not for the most part, unless diabetes runs in your family, unless alcoholism runs in your family, or cancer runs in your family, then I would say it has more of a hereditary effect. Probably the key thing here too is, the more you exercise, the less likely this stuff is going to affect you, because you'll have better blood flow, and you'll also have better glucose metabolism as well. So people who are diabetic and exercise and really watch their diet, they're going to do pretty well, for the most part, with keeping the diabetes under control. And I do know a couple people in their 80s who do that, pretty well. I see them at the gym all the time, and kudos to them for really managing underlying condition and managing it very well. So I have to say that does it's good to see that. Next question is, peripheral neuropathy permanent? I guess that can be. It depends if the person's willing to make those changes in their lives to make a difference. Now, here's another one. What does peripheral neuropathy mean? Well, it means you have lack of blood flow, lack of stimulation, poor glucose metabolism, not enough oxygenated blood, and you're gonna have pain, leg pain, numbness, like feel like you're walking on glass. The lack of sensation in the feet. You can't, some people like aren't aware that they have like a cut on their foot. The cut gets infected. That's actually a pretty important point. Is that when you have neuropathy, you really should be under regular podiatry care because it can creep up and cause some serious issues that become much more devastating because there's so many nerve endings in the feet that you have to be cognizant of that because if the nerve endings aren't feeding the brain the right information, you're gonna have a little bit of a problem there. And the next one is peripheral neuropathy dangerous? It can be. I mean, I think that's a pretty safe. It can definitely be. You know, can definitely be an issue. Okay, probably again with falls. Um, lack of sleep. I mean, probably the fall. Peripheral neuropathy can be dangerous, especially if it's due to falls. Let's leave it at that. Next question is: can peripheral neuropathy be caused by a bulging disc? You can have chronic nerve pain from a bulging disc, but if you treat the bulging disc, you shouldn't have the nerve pain. So chances are it's not a. You can have both at the same time. Somebody with cancer or an alcoholic can have neuropathy and a bulging disc at the same time, but they're usually not lumped in together, as far as I can tell. Somebody else may have a different opinion on these things, but what I see here is that no, I think it's very much a it's two separate issues that just aggravates each other, and that's pretty much the way that we work around that one. So it's like it can be caused. Okay, what's peripheral neuropathy? Well, if I haven't answered that one yet, nerve pain, chronic nerve pain, numbness, tingling throughout the lower and upper extremities, made worse by diabetes, alcoholism, cancer. That's actually not the cancer; it's the chemotherapy, and sometimes trauma. But trauma is very little that I can see. So hopefully, um, what's peripheral neuropathies? You get the gist of it by now if you've been listening. Who treats peripheral neuropathy? Well, Neuropathy CoreHealth, by the way. Uh, Bing. So typically, you're going to go to a neurologist. The neurologist is going to put you on a medication. They may do a needle EMG. A needle EMG is going to be very painful, and you probably don't want to be taking a needle EMG. That's the thing is it's very painful. Or they do an actual biopsy. They do a biopsy on it where they dig out the tissue and they do a count about how thick the blood vessels are. Again, pretty painful. You probably don't want to do that. We use a thermal imaging study. The thermal imaging study is so much easier. You can see if you're getting adequate blood flow. We do a pulse oximeter test. We do a series of tests to determine if you have neuropathy. Here's an easy one. So who treats neuropathy? If I didn't answer it, medical doctors, chiropractors, physical therapists, everybody does it. Acupuncturists, but everybody's got their own bend on it. If you're going to go for medication, don't bother listening. I mean, you can listen to get educated, but it's just not the way it's going to make much sense because the last thing you need is yet another medication. Can peripheral neuropathy cause itching? Hell yeah, because you're not getting the blood flow. A lot of times, if the capillaries are kind of collapsing or they're really shrinking because they're not being energized by blood flow going through it enough, they start drying out. Yeah, you can definitely get some itching. And itching is kind of it goes along with numbness and tingling. So when you have peripheral neuropathy, you can definitely get itching. Um, I think this one already came up. Can peripheral neuropathy come and go? It can come and go in the beginning, but not much longer. What causes peripheral neuropathy other than diabetes? Well, alcoholism, chemotherapy, idiopathic is when we just don't know. People just have neuropathy. And those are the primary drivers there, really, just primary as far as I'm concerned. Diabetes being the bigger one. Is peripheral neuropathy painful? It definitely could be painful. There's no doubt about that. Um, it can be very painful, especially at night. You're laying down and your legs are restless and trying to trying to get some sleep. So that's the definitely can be very painful. Why does peripheral neuropathy cause fatigue? I'm going to tell you why peripheral neuropathy causes fatigue. It causes fatigue because you are not getting the rest you need at night. Okay. It's kind of like if you wanted to go up a set of stairs and you had to carry 50 pounds up the stairs, you're not going up the same way as you would have earlier. You know what I'm saying? Without the 50 pounds, like a monkey on your back. Well, your body's not up to it, and your body's in a weakened state, so definitely going to cause fatigue. And also, too, is you're going to have fatigue if your glucose is not regulated properly. If you have hypoglycemia or hyperglycemia, you're going to have changes in that will cause fatigue. So clearly, peripheral neuropathy can cause fatigue. It's actually probably one of the symptoms I didn't mention earlier, but it's good to go over now. Peripheral neuropathy, when to go to the ER? Well, if you need to go to the ER, you should know that yourself. But um, if you go to the ER with numbness, tingling, night pain, chances are they're going to make you wait and take care of everybody else with a little more serious condition first. I think the first thing anybody should do is, first of all, you suspect it, you sure as heck can come to Neuropathy CoreHealth and get tested for it using very non-invasive methods, or you go to your MD and to probably do blood work, say you're pre-diabetic or diabetic, and go from there. Um, with tumors, with cancer, and chemotherapy, it's a little bit differently. But you probably shouldn't go to the ER when you have neuropathy. You know, where does neuropathy start? Starts well. It's going to start in the legs and the hands. That's a thing here. Here's an interesting question: which statins cause peripheral neuropathy? Statins are a class of medications that long-term studies really haven't been done on. I mean, everybody takes them, but long-term studies is just everybody thinks it's such a wonderful medication, but your body actually needs cholesterol. It requires cholesterol. Your brain needs cholesterol. Hormones are produced with cholesterol. So statin, it's a topic. I mean, all statins can cause peripheral neuropathy, but that's not like anything can cause peripheral neuropathy. But for the most part, no. I'd have to say statins are not the cause of peripheral neuropathy. But if it sounds like confusing you, I'm not, because it's honestly a statin shouldn't cause neuropathy. But the last thing you need is yet another pill. I mean, I'm not a big pill person. I don't recommend taking them. I think, you know, people just assume that if you're taking pills, you're healthy. How about you get on an exercise bike and go from there? So just if you can avoid a statin, go exercise, eat properly, get outside, get some fresh air, get some good rest, and so that would avoid taking a statin, which with this question will cause that peripheral neuropathy. Is peripheral neuropathy progressive? Yeah, I guess so. That's a pretty fair question. And what causes peripheral neuropathy in diabetes? The blood flow, I would say, and then the lack of the blood flow, lack of blood flow, lack of oxygenated blood flow, but even more so, the glucose regulation would be the primary drivers of peripheral neuropathy and diabetes. What makes peripheral neuropathy worse? More illnesses, more pills. The more pills you take, the less healthy you are. Um, can peripheral neuropathy cause headaches? It can. It can, but not for the most part. I mean, you have much more stuff going on. Here's a pretty easy one. Is peripheral neuropathy serious? Like we said, it's serious as cancer is serious, as diabetes is serious, as alcoholism is serious. Yes, it's serious and does require work, not just with the doctor, with the patient as well. Another question: can peripheral neuropathy cause dizziness? Not well. Lightheaded, yeah, if you're not getting adequate blood flow to the brain. And take it back a few questions early. If you're on statin, the brain needs cholesterol. So um, we're never going to see these studies come out from big pharma on the effect of cholesterol or lack of cholesterol, because they keep saying how we get lower and lower and lower, but people are still dying of heart attacks. That hasn't changed, but everybody's convinced that they take a statin, they're healthy. Rethink that idea, okay? What helps peripheral neuropathy at night? Taking care of it during the day. Doing more work at home, getting some laser light therapy, getting some stimulation, getting proper exercise. Um, so those are really important things to consider when you are neuropathic. Question came up again. What are the signs of peripheral neuropathy? I think we already beat that one up. Will peripheral neuropathy go away? The symptoms will go away, for sure, if you take care of it. How does peripheral neuropathy progress? Well, if you keep ignoring the symptoms, you keep ignoring the fact that there's an underlying condition that requires effort on your part, not just the doctor or the medication. If you're relying solely on medication, well, probably not gonna. It will progress on its own. And what triggers peripheral neuropathy? Well, we beat that one up, I think. Why is it dangerous again? So some of these questions are repeats. So what I'm going to suggest we do here is, if you have questions on peripheral neuropathy, give us a jingle, 203-875-0840, 203-875-0840. Dr. Brian McKay, Neuropathy CoreHealth, not just a chiropractor, Stanford, Darien, Norwalk, and New Canaan. All right, a lot of questions. I appreciate it. Hope you learned something today. And if you have questions, fire them off. Thanks. Keep listening.